This morning, the government is urging parents to get their children vaccinated after a spike in measles cases. The CDC reports 129 outbreaks in 13 states since January.
That is the highest number of cases for the first 4 months of any year in nearly 2 decades. Our Dr. Holly Phillips is with us. Good morning.
Good morning, Nora.
So measles was eradicated in the U.S. in 2000. What's behind this outbreak?
Well, the CDC has linked a number of these cases to being imported from places where measles is more common. The Philippines is one of those places. But then out of people who are now contracting it within the country, the vast majority are unvaccinated, some for personal reasons, and others who are children who were too young to be vaccinated yet.
And how serious are these cases of measles?
You know, measles is a really serious illness. A lot of people still refer to it almost as a rite of passage, like a childhood illness, as though it's the common cold. But it really causes complications, things like ear infections, pneumonia, and it's clearly life-threatening. The other important thing about measles is that you're contagious for 4 full days before you get any symptoms at all. So it can spread like wildfire through a community if you're not vaccinated.
Oh, you mentioned that a lot of people who are getting this are not vaccinated. I know the CDC did a study of the effectiveness of vaccine programs. What did they find in that?
You know, the vaccine program, which launched in 1994, called, Vaccinations for Children, it has been very, very effective. 3 million illnesses have been prevented, and it's still doing very well. In most states, 90% of people get vaccinated for measles right on time, but in 15 states, the numbers are lower. California is one of those states, and so not surprisingly, they're the state hardest hit by the measles right now.
And, as a physician, when you hear this, do you worry? This is the effects when you don't get your children vaccinated.
Very much so. We really don't want to see these sorts of pockets popping up, especially for a disease that was theoretically eradicated many years ago.
Dr. Holly Phillips, thanks.